Hello, everyone. Welcome to Blind Spots. I'm your host, Gail McDonald, and I'm here today with two very special guests, Dr. Amy Kirkham and Dr. Carla Prado. Dr. Amy Kirkham is an assistant professor in the Faculty of Kinesiology and Physical Education at the University of Toronto, an affiliate scientist at the Toronto Rehabilitation Institute, and a national new investigator for the Heart and Stroke Foundation of Canada for her work in characterizing the unique cardiovascular needs of women with a history of cancer. Dr. Kirkham co-leads the Center for Cardiometabolic Oncology, Diet, and Exercise for Women, otherwise known as CODE-W. Dr. Kirkham's research program, operating within CODE-W, aims to characterize the intersection of cancer, cardiovascular, and metabolic disease in women and quantify the therapeutic benefit of lifestyle interventions with exercise, diet, multimodal rehabilitation to prevent or ameliorate cardiovascular and metabolic dysfunction and disease. Dr. Carla Prado is a leading nutrition researcher, registered dietitian, and Canada Research Chair in Integrative Nutrition, Body Composition, and Energy Metabolism at the University of Alberta. She directs the Human Nutrition Research Unit, an internationally recognized center for body composition and metabolism research. Her work focuses on how nutrition and muscle health affect people living with chronic conditions like cancer. She uses tools to assess body composition and energy needs and is developing personalized nutrition strategies to help people stay strong and recover better. She is recognized for her impact in the field, including being named one of Canada's most powerful women in the top 100. Thank you both for being here today. Welcome to Blind Spots. I'm so very excited.
Thank you so much for having us. It's a huge pleasure.
Oh, and it's a pleasure that I have with you as well. So thank you so much. And Amy, welcome to you as well.
We're happy to be here and happy to chat with you today.
Excellent. Thank you. So we have a lot of information to cover, and it's very important information. I know it's going to be of great value to our audience. So the first question that I would like to ask you is, can you briefly tell us about your research programs and what drew you both to this field?
Go ahead, Carla.
Sure. So I'm a registered dietitian, as you've mentioned. So I'm involved in the world of nutrition, and most of my research program focuses on clinical nutrition. So people who have conditions or diseases that we're trying to really counter a lot of the consequences and improve their life outcomes through nutrition.
Mm-hmm.
And my lab is focusing on assessing the nutritional status of patients, and also how can we come up with more targeted or more refined interventions to help people live longer and better lives.
Mm-hmm.
And I am very passionate about the power of nutrition, working with patients to also come up with what's important for them and meeting new colleagues, establish new collaborations, and just expanding how nutrition is, or how people see the importance of nutrition throughout the life cycle, throughout all ages and all diseases, and even for longevity, as I've mentioned, for us to live longer and better lives.
Yeah, excellent, Carla. Thank you. And Amy, how about yourself?
Yeah, thanks, Gail. So my expertise is primarily in exercise and cardiovascular health. And I have a strong focus in my research program on cardiovascular health of women in particular, because women are very understudied in this particular area. Still a large part of my research program is actually focused on women with breast cancer, and that's actually how I got into the field accidentally. The first ever study I worked on was an exercise intervention during chemotherapy for breast cancer. And I had gone to do research in athletes and ended up working on that and felt like, oh, this is so much more important and purposeful for me. Immediately fell in love with it. And then as I worked more with women with breast cancer, I learned about how breast cancer treatments can affect their cardiovascular health. So I became more interested in that aspect of breast cancer. And then kind of since then, building that expertise, working with women with breast cancer and their cardiovascular health, I've then expanded to more broadly, generally women's cardiovascular health. And I do some studies that also look at exercise and nutrition, in large part with collaboration with Carla, on trying to prevent cancer, cardiovascular disease, diabetes, specifically in women for the most part, as well as treating cardiovascular health and metabolic health in individuals with those diagnoses.
Well, as I told you when we first met, that's a huge interest to me, both health and exercise. And I recall my chiropractor saying many times, you can't out-exercise a bad diet. And I was thinking possibly he saw me walking down the street eating ice cream or something like that, calling me out on it, right? Excellent. So, of course, my biggest question for you both is, how did you meet? How did your collaboration begin? So, Amy, how about we start with you on that one?
Yeah, sure. So I think our collaboration is quite unique. Carla is a world-renowned expert in nutrition, and I'm an expert in exercise. And we collaborate very closely on a number of different studies that involve both nutrition and exercise. Primarily, our work is in individuals with cancer. But traditionally, professors in those areas stay in those areas, right? We're in different departments of the university.
Yes, yeah.
There's sometimes some collaboration, but I think we're unique in how close we really are and how well we work together and how we truly integrate our expertise into given studies. And so the story of how that came to be was that I was doing a postdoctoral fellowship. For those of you who are not familiar with academia, that's essentially the step between doing your PhD and becoming a faculty member, becoming a professor.
Thank you for that.
So I did that at the University of Alberta, where Carla is a professor in the Department of Biomedical Engineering. And I was focusing on learning MRI techniques to kind of quantify the effects of exercise interventions in my research on different aspects of the body. And I just started reading about nutrition and caloric restriction in particular, and had an idea for a study where I wanted to integrate some nutrition. And one of our mutual colleagues, Dr. Edie Petuskin, said, "Oh, you know who you should talk to is Carla Prado," and she's like right down the street. And so I didn't know that before moving to Edmonton that Carla was there. And so we had that introduction, and Carla gave me a tour of her lab, which is incredible. And she just, immediately shared her passion for nutrition.
Yeah.
Was, never really that focused on it before, but that just Carla really made me want to do nutrition. And then just the fact that we, got along so well, and had scientific chemistry, if you will.
In more ways than one, right?
Yeah. And I'm going to add here that Amy, she was applying for an international award, which was also a grant, which I don't know if anyone else in Canada had won that before. So she, reached for the sky, and I love that. I love, how in a healthy, ambitious way, how she is. And she has this ability of bring people together. And as she mentioned, the uniqueness of our collaboration is what we need more in the world, because it's trust. It's like, there's space for all of us to shine. It's transparency. It is loyalty as well, which I love. Loyalty for me is one of the biggest qualities a person can have. And we just have that. And, Amy actually brought together a bunch of people who with the same, skills in terms of, or I would say even like, approach to academia. And I think that that's wonderful. So she created such a huge cohesive team and introduced me to other colleagues at UofA that I haven't worked before. And now, we have several studies. I lost count, but we have this partnership that extended now across the country because of Amy and her vision and her initiative as well to bring people together.
It sounds very unique. And actually, that was going to be the next question, but you've answered quite a bit of it. The question that I was going to ask is, what makes your partnership unique? And how has it helped you grow your individual research programs However, as I said, Carla, you have really answered that well, but is there anything either one of you would like to add to that about the uniqueness of what you are doing together?
Yeah, I think in terms of allowing our programs to grow, I think an important component here is that, at the time I was junior, I didn't have a faculty position when I first met Carla. And so she was quite established already. So it's been very huge in how me getting a faculty position at University of Toronto and starting a new lab on my own has really helped the direction of where I go. And now nutrition is actually a huge part of my research program.
Mm.
Um, Continuing with my collaboration with Carla, we have a number of different studies that span the country that are in Toronto and Edmonton at the same time.
Excellent.
As well as like other nutrition studies now that I have with other nutrition colleagues that I've met. That's in huge part to our collaborations. And so I'm sold. Like as a like I'm very sold on the importance of nutrition. And I don't think I will ever go back to, ignoring that aspect. They're just two sides of the coin, right? And so I think, I look at some of my exercise colleagues now that have pay no attention to nutrition. I'm like,
Yeah.
you're missing something really important here.
Yeah, exactly.
We say
Carla?
we say in our field that it's like exercise and nutrition are divorced. If you look at the studies, it's almost like, really people don't give the value. Sometimes it's almost like tokenism. We've done one assessment to say we've assessed nutrition or not, but it's really not engaged and not really connected in a way that we're bringing that together. So then, the other thing too is that, for example, Amy and I have a very strong focus on mentorship, mentoring the next generation of trainees. So one of our trainees was a visiting student today, has won the biggest fellowship in Canada. So we're training the next generation together as well and empowering them to, reach for the sky and, make sure that our ceiling is their floor. Type of thing.
Wow,
So we're
like
mentoring the next generation, and
Yeah.
I'm so proud of that. And we've seen them grow, and we have a lot of publications that are going to be upcoming. Like they're gonna come up. And Amy was I love to say that, but she was a new professor, just establishing herself. Yet we were able to piggyback, I'm gonna say that, in her study, collect extra data, and she was like the first to say, and we've said, okay, do you want to be, the positioning of authors in an article counts for our academic profession. And as she mentioned, I was already, established professor. I didn't need that, but she's like, no, it's your study. You're gonna go with this position. So she was like very generous, I would say, and also thinking about, the group. It's like it's not about me growing our the spotlight on me. It's our group, and I think that we need more of that in academia. We need more of that in the marketplace. And I always say that we grow together, right? Like people who have stabbed us in the back, we don't work with them anymore. They lose opportunities to work with us. But when we hold hands, we have more. We always have more.
Wow.
I recently said in a presentation, life's too short to work with jerks.
True.
Well, I tend to agree with you for sure. Definitely. I mean, life is so short in many ways. We don't realize it. And when I hear you both speak, what is coming to me is a phrase I heard about leaving the world better than you found it. Yeah. Because after we're all gone and people in our age range are all gone, like years from now, what is it going to be like? And it's just, doing what you love. And I hear both of you, and there's such an authentic passion. And I love what you said, Carla, about, you're there for them. Yes, it feels good and you're proud of it, but you're also really proud of, what other people are accomplishing and how you're all doing it together. And there is such a synergy in that. And that is when things really happen. So I'm just so happy for you both, because you seem, well, you are very passionate about it, and you're doing such great work. And I'm such an advocate for, as you've said, the connection between health and nutrition. And I think in our first, we had a first meeting, like a meet and greet. And as I was mentioning, as an example, is that somebody goes for a run and they come home and then they crack a beer. Well, maybe a bottle of water would be a better choice, right? So yeah. And if you do that, that's fine. I'm not judging, just saying as an example, right?
Yeah.
For sure. All right. So anything else before I move along to yet another question?
I guess that's it.
Okay, excellent. Thank you. So, women's cardiovascular health and exercise. Firstly, Amy, why is women's heart health still so under-researched?
Yeah, so out of all of the medical disciplines, cardiovascular health and neuroscience is a close second, are the most understudied in women compared to men. And so this really stems from policy enacted by the NIH in the US that systematically excluded women from participating in clinical trials. And so originally the idea was that that was going to be beneficial to women because they were, in reproductive years, there was big concern over them taking drugs that could affect the child development. Right? And so at the time, the mentality was, well, women are the same as men. So why don't we just put the onus of participating in research on men? They'll take that.
Okay.
Right? So obviously women are not the same as men. We know that very clearly at this time. But unfortunately, that decision did irreparable harm to research. And so that since the 90s, that policy has been completely reversed, and it's now required that women participate in clinical trials. But we're still so far behind, especially in cardiovascular health. And one of the reasons that was identified for that is that out of all the medical disciplines, that discipline is still so dominated by males as physicians, as researchers, as principal investigators of clinical trials. And so that was the case for me too. Like all of my mentors in cardiovascular physiology were males as well. And there just tends to be not as many women in that discipline. And so, me as a female leader, I attract females in my lab, and I also focus on females in my research. So naturally, that's the direction that I'm going to try to I'm not going to say reverse, but try to even out the disparity in research being done. So I could do research exclusively on women for my entire career, and I think we still wouldn't, catch up necessarily. And so we do know that women's hearts and their vessels and many other aspects of their physiology are different to begin with from men. They react differently to medications, to nutrition, to exercise.
Wow.
And then on top of that, menopausal stage can also impact how women's bodies react to these things. So it's really important that we study women and we study them at the different life phases to truly understand how to give evidence-based research and medicine that is specific to women. So that's a big goal of my lab, and talking about mentorship as well is trying to train that next generation of researchers, whether they're male or female themselves, it doesn't matter, but to really consider the sex-specific needs of research and practicing medicine as well. So I tend to get a lot of individuals joining my lab who want to be doctors eventually too.
Okay. So what I'm hearing you say, just to confirm, is that when doing research, there is a different approach depending on the gender of the individual.
Yeah,
because we are different.
So I would say the gender and sex. So those are actually two different concepts. So sex refers to the biological nature. So what was born as male or female.
Okay.
But gender refers to the social norms and roles that someone takes on in their life.
Okay.
And so that gender can also affect things about uptake and access to care. So, for example, women are systematically given different treatment approaches from physicians, or taken less seriously sometimes when reporting different side effects. And so it's the interaction of both of those things, because the biology itself also affects how those medicines affect one's physiology. So every cell and organ in our body, biological sex effects. So it needs to be something that we consider in all aspects of research, including, we're looking at cells in a petri dish, we're doing research in animals, or we're doing research in humans. It's something that is a key component that we need to study and is traditionally not been a big focus. Even animal studies, they tend to mostly be male animals.
Okay, wow. I want to thank you for the clarity on that. I have really learned something with that. It just really puts a different light on it for me as to how things are done. And I understand very little about what you both are doing, but other than, of course, what you've shared up to now, but just the way it's done is really fascinating to me. Mm-hmm. Very fascinating. So thank you for that information. And the next question with regards to that, Amy, is what do we risk missing by not studying it more thoroughly? And you may have answered that question a little bit, but is there anything else you would like to speak to on that?
Yeah, so I think we're risking not having evidence or evidence-based medicine that's specific to women. Mm-hmm. So, to put it bluntly, we may not know how to treat 50% of the population by not including women in research.
Okay.
That's a scary statistic to think about. Mm-hmm. So that is the case in some areas of cardiovascular health. And including in my area of exercise physiology, what we teach students who take mm-hmm. these degrees, like kinesiology is my program, mm-hmm. What we're teaching them in a textbook about the health benefits of exercise, how it improves the heart and the vessels and the muscles and so on, mm-hmm. is what happens in men. And in some cases, the opposite can happen in women. Or what we learn about as benefits, like improving the function of the heart, for example, mm-hmm. can either, in premenopausal women just doesn't happen to the same extent in men, and in postmenopausal women doesn't happen at all. Mm-hmm. And so that's quite shocking, right? Like what we're teaching our students and what I learned myself mm-hmm. is not necessarily applicable to women. So one of my biggest studies right now is doing the largest ever exercise training study in women, mm-hmm. in both premenopausal and postmenopausal women, and looking at how it benefits all of the aspects of the body, from the heart to the vessel to the bloods to the skeletal muscle, and adipose, the fat tissue as well. So we can actually characterize and know what's happening in women and whether that differs by menopausal status as well. Mm-hmm. So that's one study that I'm really proud of, and it takes a huge team and a lot of money to do that. Mm-hmm. And that study is funded by the Canadian Institutes of Health Research. So I do want to give a call out to them because they're a federal funding body that funds health research. So we certainly have recognized the importance of studying women.
Mm-hmm. Mm-hmm. There's so much involved in what you're both doing. There's so many people, so many organizations. It's overwhelming to me to hear what you're both doing and the expansive network of people that you have created, that you will continue to create. I'm quite healthy. I do exercise regularly, and now I want to exercise more. Just to see if I can get. What's that?
I have that effect on people.
Yes, well, that's great. Maybe I should hang out with you on a more regular basis, the both of you, and I'll have Carla watch my ice cream intake. Yeah, perfect. All right, so a couple more questions here, and then Carla will take it over to you. But what can you tell us about the recent research showing exercise helps people with cancer live longer? And this is Carrie Cornea's study.
Hmm. Yeah, so all of my graduate training, my original research training was all in the field of exercise oncology. Mm-hmm. So using exercise specifically to help people going through cancer treatment or with a history of cancer diagnosis and treatment as well. And so traditionally we focused on what we call like surrogate outcomes. So we're looking at, does it improve individuals' quality of life, their cardiorespiratory fitness, their strength, and maybe some like markers in the blood that give us information about how long they might live or how their cancer is responding. But really, like the thing that we care most about is it going to help people with cancer to live longer and to fight their cancer? And so to do that type of study is an absolute huge undertaking. And so it's really exciting that one of Carla and our colleagues, Dr. Carrie Cornea, who's also at the University of Alberta, has just finished the first study to ever do that. And it took him about 10 years. We included 55 different sites across the world who recruited patients to contribute to, it was almost 900 patients that they had to enroll, and they were randomly assigned. So it's like tossing a dice to put the patients in either a group that did exercise for 3 years, recently after their completed chemotherapy for colon cancer, or to do usual care. So just keep up with their usual life habits. And so they did find that doing that exercise helped to reduce the risk of the cancer coming back, or their survival and cancer not coming back by the same extent that some cancer treatments, like some cancer drugs, help. So that was a huge finding, and it was very highly publicized among all the biggest medical oncology conference in the U.S. All the physicians are very excited about it because that's the money, right? For the oncologists, they want their patients to live longer, right? Like they're very happy that exercise improves quality of life. But the thing that matters the most is having their patients survive without having a cancer recurrence.
Because there is some weight. Oh, sorry, Amy. We cut out for a moment. I'm sorry. What did you say lastly?
I was just going to say, so that was a huge result for the field. Really just hits home on the importance of exercise for individuals with cancer.
And it shows that it's beyond medicine as well, right? Like we can combine exercise, we can combine other auxiliary, I would say, treatment strategies. And again, like exercise in this case is like a medication.
Wow.
So I will clarify though that these patients still have their prescribed cancer treatments, right? We're not substituting cancer treatment with exercise. It's an adjunct. So we use it in addition to what the oncologists are
providing. Right. And from what I understand in your bio, is that it helps to perhaps sometimes reduce the symptoms of the medication. I mean, the medication is a must in many cases, but people can feel so tired and so sick, and it's better to have a healthy diet and do the exercise you can relevant to where you're at in the stage that you're in, and just have a less difficult time with it.
Yeah, exactly. That has been a big focus of my research, is how to use exercise and nutrition to reduce the side effects of cancer treatment.
Right.
Because if people can tolerate the cancer treatment better, then they can actually get more of the treatment that helps to prevent the recurrence of cancer. Along their survival. And additionally, a big focus of my research is one of the worst side effects of cancer treatment, which is called cardiotoxicity. So that refers to cancer treatments actually injuring the heart. And so a number of different cancer treatments have the potential to injure the heart. And as a result of that, plus other factors, individuals after surviving certain cancer types are at 2 to 6-fold greater risk of dying from cardiovascular disease than individuals who haven't had cancer. And so that's a little known facet of a surviving cancer diagnosis. And that applies to early stage breast cancer. And that's a big focus of my research. And it's quite a success story that our mortality from early stage breast cancer has decreased 50% since 1986 in Canada because we're better at treatment, right? So we're better at screening, early screening, we're better at treating the cancer. So that's such a huge success, right? But now that it's not a death sentence anymore, we have to care about these other things that might affect them, including the side effects of the cancer treatment, and the worst of which is the potential effects on the heart. So this is actually a field called cardio-oncology.
Okay.
So it's a combination of cardiology and oncology. And it's really only been in existence for about 15 years, I would say, both a medical and a research field. And it really deals with the potential for cancer treatments to injure the heart and the excess risk of cardiovascular mortality that cancer survivors face. And so that's been a big focus of my research, especially in breast cancer, because so many women are diagnosed with breast cancer and will survive it in Canada now. I recently did a paper that showed that 2% of the female adult Canadian population have had a cancer diagnosis and survived it in the last 15 years. 2%. So 2 out of 100 women walking around that are adult age. And then if we look at age 60 plus, it's about 5% of women have had that breast cancer diagnosis and survived it. So it's quite a large contingent of the population where we now have to be concerned with these side effects. And so my research focuses on using different nutrition and exercise strategies, new ways of combining them or new approaches to try to improve that, I guess, reduce that risk of cardiovascular disease after surviving cancer.
I'm really starting to see the fusion of what you're both doing, and I wouldn't think that I'm alone in thinking that I'm amazed. I had no idea. No idea. It's like a person gets cancer and you beat it, and then you think you're good, and then what might happen later on? No idea.
Yeah,
and that really is encouraging.
Have the diagnosis don't know that.
Yeah,
that's why we're in the blind spot.
Yeah, exactly. Yeah, so we totally have to go viral with this, but I think I think everybody in the whole wide world needs to know this. And if I think of just my circle, my family, my friends, it's like almost every other month somebody's being diagnosed with some type of cancer, and we've lost 2 very close, like a family member and a close friend, in the last year and a half.
Sorry to hear that.
And it's just so common nowadays. And then to think about, as you've talked about, Amy, the repercussions of what could happen. I think of, what is it going to be like in 10 years if we don't educate, if we don't shift our lifestyle, and who can be advocates for that? Anybody can, whether you've experienced it or not. It's just, let's work on being proactive instead of reactive, and everybody would benefit. I'm truly amazed. I'm close to speechless, but we do have a talk show to do, and it's very rare that I'm speechless. Ask anybody that knows me very well. But this, all kidding aside, this is such important information. Yeah. I am so really honored that you both took the time, from what I can't even imagine your schedules would be like, to be here and share this information. And we're going to really get this out there for sure. All right. So lastly, ways exercise can help with heart health, with both prevention and recovery. Again, you may have said some things that address this, but is there anything else that you could add to it to help our audience change a small habit, even today?
So exercise, specifically aerobic exercise, so that's things like brisk walking, riding your bike, swimming, for example, things that really stress the heart, is the number one best way to prevent heart disease.
Yay.
I'll stop.
Okay, I love it. I'm in. I do it already. Whoopee!
Yeah. So that's great. Resistance exercise can provide additional benefits as well, and Carla's going to talk about that in terms
Yes.
of muscle mass as well. So I'm
Mm-hmm.
a huge proponent of both types of exercise for
Mm-hmm.
overall health and longevity.
Mm-hmm.
And so, additionally, once someone has had a heart condition too, it is also the primary strategy to help recover and to prevent future cardiac events. And so the medicalization of that is what's called cardiac rehab.
Right.
So
Yeah.
everyone's heard of that. It's a
Mm-hmm.
hospital-based
Mhm.
multimodal rehab, but exercise is the cornerstone. Every
Yeah.
single cardiac rehab program involves exercise as like the
Mm-hmm.
primary therapy, and then there's traditionally additional therapies. Nutrition is one. It's not very well done in most cardiac rehab programs. But and then there's also like medical management from a physician as well. So it is
Yeah.
multimodal. But it is, the first medicalization of exercise. So it's the first integration of exercise as a therapy. It's been since the 1950s, I think, when it started in hospitals here in Canada. And it is accepted as this is the best way for a patient who's had a cardiac event to try to prevent another cardiac event, to improve their quality of life, and
Mm-hmm.
to try to prevent mortality as well after that cardiac event.
Mm-hmm.
And
Mm-hmm.
I love that Amy mentioned like the multimodal. So we use that
Mm-hmm.
word a lot, especially in our research programs, because it's
Mm-hmm.
combining what works from different fields and bringing together people from different areas. So not only nutrition and exercise, but mental health professionals as well, and
Yeah. Yeah.
a number of other healthcare professionals. And I like to use the analogy of the three little pigs story. And we're building the house of brick when you're combining what works best
Yeah.
from different worlds and different
Mm-hmm.
expertises.
Right. Thank you for that, Carla. And I guess now there's more to hear from you, Carla. Amy, thank you for that. I feel very informed.
Yeah.
I'm not a
Right?
scientist, I'm not a medical professional, but what you've told me has really inspired me to do more of what I do. I still want a cheat day though. Like, can I do that? Like, can I have an ice cream cone? I'll ask Carla, like
Absolutely.
on a Saturday,
Absolutely.
right?
It's
Yeah.
all about balance. You know what I mean? Like
Yeah.
when we have very restrictive diets, it doesn't work
Yeah.
for the long term. So absolutely, you
Yeah.
can have your ice cream. I'll have
Yeah.
it with you next time.
Okay. Excellent. Yeah.
We
Well,
have a meeting.
yeah, I have it with my dog actually. I did walk him
Yeah.
8K one day and I'm like, okay, buddy, halfway,
We
we're
need
going to have a cone.
it.
Yeah, for sure. Yeah. All right. So thank you so much, Amy. Carla, moving on to you. You focus, as we know, up to now on nutrition and muscle health. That's always fascinated me. It's like, well, how is it that what I eat has an effect on my muscles?
Right?
And
Yeah.
my limited knowledge is, protein builds muscle because we see that on all the commercials and in
Right.
magazines.
That's great. Yeah.
So
Yeah.
why is muscle such an important focus, especially in clinical populations?
Oh, that's an excellent question. And historically, we focus a lot on body weight. And when we go to the doctor, we're doing our physicals. We're going to step on a scale. They're going to be tracking our body weight. But looking at what we call body composition is really trying to understand where that body weight is coming from. So the different proportions of muscle and fat, there are other body composition like bone, for example, compartments. But we're very focused on, we all know excess fat may be detrimental to our health. But I'm particularly focused on the importance of muscle. So, out of the body, the bulk of body weight, what does that amount of muscle, how does that amount of muscle matter? And that's important because people can have exactly the same body weight on the scale, but very different amounts of muscle and fat. So at any given body weight, you can have a person who has very little muscle, average muscle, or high muscle, but on the scale, their weight is the same. So our research program is looking into not only identifying this low muscle mass, or we call like this type of or phenotype of low muscle mass. So what's the prevalence and why does it matter? So we all think of muscle as an organ that's responsible for movement, for balance, for posture. But muscle also has very important metabolic health in our body. So, for example, low muscle mass can weaken our immunity, making individuals more prone to infections, reducing their abilities to recover from illness, from injuries, for example. Muscle also helps us regulate our blood glucose levels, by taking up glucose, and it can can help to prevent conditions like insulin resistance and diabetes. It also storages amino acids, which are the building blocks, that our body relies on during times of stress, injury, or infection. So when our muscle declines, our body ability to handle metabolic stress is going to be compromised. So that's what I say. Our muscles, it's like a metabolic powerhouse. And there is a lot of research, like thousands of publications that show us that low muscle is associated with poor wound healing, for example. As I've mentioned, if people are hospitalized, if they have low muscle, they may stay at the hospital for longer lengths of time. It obviously improves decreases our quality of life, like our ability to be independent. Depends on muscle. If you think of opening a bottle of water or a jar of jam, for example, you need our strength, right? And so those are some of the things that start it can be used actually even for you to kind of have an idea of how strong your muscles are. If you're going to get up from a chair, we're going to use our muscles. So it's very, very important as well. And we are trying to find ways also to counter that with nutrition.
Again, just news to me. Some of it I was aware of. I understand there's an importance to that, but just the information you described about how well it can serve us to have the muscle mass that we require to do some of the simple things every day.
Right. Yeah.
So
simple things. Exactly. So sometimes people don't think, like, even if when you're feeling very tired or fatigued, it could be related to muscle loss. All of those things may be related.
Wow. I'd like to just go out for a run right now, but we're going to stay together for a few more minutes, right? Okay. So the role of nutrition that plays in the recovery and resilience. I love that word, particularly for people living with or beyond cancer.
Yeah. So again, everyone thinks, if we think of muscle, we think of exercise, and Dr. Kirkham is here. Amy is here, can talk about that as well. But nutrition plays a huge role in helping people who have cancer or have recovered from cancer, and for any of us, obviously. For us, as I mentioned before, living longer lives, living better lives. And when someone is going through cancer treatment, like chemotherapy or surgery, their bodies may need extra energy and nutrients to heal, fighting the infections, and simply to keep going. It is an insult to our body, right? Like everyone who has dealt with that know the consequences. But here's the catch: many people, they may lose their appetite, they may struggle to eat well during that time. Even people with obesity, for example, who have lived with larger body sizes. And sometimes people even think, oh, it's great, I'm going to lose weight, but it's certainly not. We don't want people losing weight when they are undergoing a cancer treatment, because that can lead to muscle loss and feeling even more tired, or having the consequences of this loss of muscle that I've mentioned before. So, and that's where nutrition can step in. It's not just about calories. It's about having the right quantity and quality of nutrients. Our nutrition is like fueling our muscles. It's fueling our bodies as well. You've mentioned protein, especially protein. Obviously, it's very important to maintain strength, help people really undergo that stress that we've mentioned, that is cancer treatment. So when we have like good nutrition, is helping everything, is helping your immune system, is helping treatments work better, and it's helping your energy levels. This is why nutrition and exercise are a part of what we call supportive cancer care. So it's supporting us caring for cancer and even doing the cancer treatment as well. And even after treatment ends, eating well really helps people regain that strength, regain that muscle loss. I say that muscle, I use a lot of analogies. As you can see, I have a little girl, so I've learned I keep reading all these stories and try to use these analogies, but it's like
Yeah.
this loss of muscle mass is like a wildfire when we have cancer. It is like our muscles are going to burn away so fast, and it takes so much longer to recover. Like when you're rebuilding this forest, and it takes time. So sometimes I'm like, okay, I'm going to follow this diet and exercise program for just a few months, and well, maybe it didn't work as much, obviously, because it's going to take a way longer than that. So it is the earlier you start, and the continuation of that is essential to, again, build that forest back, or recover, right, from the wildfire. And nutrition is such a powerful tool, not just during cancer, but long after cancer. And not just protein. We have other nutrients, other ingredients as well, that are essential for muscle health. And that's what our research program is studying. How can we optimize energy, protein, vitamin D, omega-3 fatty acids, H and B as well. So there's so many things that are related to our muscle health.
Cool. Just an education for me today, and I know it will be for our viewers as well. So Carla, you and Amy are working using digital health platforms. This excites me so much. How can digital tools empower patients and improve outcomes?
I think it's been a great experience for us. Digital health tools have been like really game changers in caring for people with chronic conditions, including cancer care as well. We have had a surge of digital platforms since COVID, but a lot of the platforms we work on have started well before that. And digital health really help us what we call scale and spread in intervention. So we're not just talking about so we're talking about like how to make something work in one place, but also reaching people that live in rural areas, for example, people who have less access to care, and also reaching many people from all over the place. So can we scale and spreading the intervention? And digital health tools allow us for this personalization that sometimes, especially when people don't have access to healthcare professionals, that is a type of not only personalized care, because people can choose they can choose what type of exercise based on the condition that they have. They can choose the type of nutrition, or I'm going to call it diet, but not diet for weight loss. It's really the choices, or the food choices that they're going to make, and how to achieve that with recipes, with a grocery list, for example. So it's a strategy for us to help personalize care for people of different ages, different health conditions. Especially now with artificial intelligence, we can really fine-tune personalization within digital health platforms. And again, as I've mentioned, meeting the needs of people in remote areas. So it's very important. And Amy is also using that in other research projects beyond some of the studies that we're working on together as well. So she has that excellent experience. Feel free to jump in, Amy.
Yeah, I think one thing I would add there is just in general, I like to think about the nutrition and exercise interventions that as a way that individuals with cancer can empower themselves to do something for their own health, right? So the cancer diagnosis, you are told what you need to do to deal with that in terms of like all the different treatment approaches. And generally, most people follow that, right? And it's might leave some people feeling like a bit helpless, like they just have to follow this prescription. But nutrition and exercise is something that people can do for themselves. So I really like that aspect of it. But I'll add to that in general, like that's hard to do alone, right? So a lot of individuals that may be enrolling in our trials don't have a strong history of exercising, don't have the knowledge about nutrition and healthy eating, right? So by using digital tools, it's a way that we can kind of provide that intervention with accountability and provide that education that's really needed to help people follow these strategies when they're going through cancer or after a cancer diagnosis. So that's like a key part of it. And like Carla was saying, not everyone lives close enough to a cancer hospital or to a university to come in and get that in-person support.
So true. Very critical. And change is difficult for most people. And when we experience change close together, like multiple things we've had to change close together, such as getting a diagnosis of cancer, and then going through whatever treatment or procedures need to be done. And then after that, being told that, well, okay, if you do these things, then this will help you as well. It's like 1, 2, 3 large changes. And it's very hard for many people to adapt that quickly to changing their diet, or for people that are maybe sedentary to even getting off the couch. It's like creating that change, like what is going to motivate me, what is going to get me to do it. And it's a lifestyle change, but just, from my own experience over the years, it can be very difficult and does take a lot of discipline and support in that community. And if there is someone on the other end of the screen, or they've got the tools, it's going to be much more supportive for them, therefore increasing the success they may have overall. So, it's, again, I'm just so, I'm feeling so much more informed, and thank you so much. So we still have a few more questions on this. So there's the study, the resilience study.
That's how we met.
That's how we met, yes. And what is it? Why is it important? I know a little bit about what it is. I also know how very important it is, but who would like to dive into that one first?
I'm going to get started with the title, Amy, and then you can jump in and talk a little bit more about how our expertise is combined in that. So resilience, the word resilience, so it's the study that Amy and I co-lead. It stands for Improving Health Behaviors for Life After Endometrial Cancer. So that's a clinical study that is designed to support women who have completed treatment for endometrial cancer and are looking to improve their health. As Amy mentioned, many cancer survivors are going to experience long-term risks like heart disease, especially if they have larger, or if they're living with larger body weights. And I often say that the health of cancer survivors often is neglected because we think, okay, we've completed cancer treatment, off you go, and you are going to undergo your normal aging trajectory. But there are consequences of cancer treatment, as you've just heard from Amy, and we're trying to counter that. We're trying to help women who have, again, completed treatment for endometrial cancer. And what we're doing is, again, combining our expertise. Is we're using the digital health platform, and it's a MyViva plan, a very dear healthcare professional who has over 25 years of experience, who created that. And this digital health platform is combining nutrition, exercise, and mental wellness. So it's 3 pillars of health. That's very important. And it's really supporting, again, women who have finished treatment and want to engage in lifestyle or this behavior interventions to help improve their lives. So this is the core of the resilience program. And obviously, this is one of the groups that we're studying. We have 2 groups. Every clinical study has to compare the intervention with another group. And our other group, which is absolutely essential as well, is looking at receiving what's normally given to patients. So they've received overall information about educational materials about nutrition, exercise. So anything that you can get or they usually get once you complete cancer treatment. And now, again, after the study is completed, everyone is going to get access to the digital platform. So this is the great part about it. But I always like to highlight how thankful we are for people in these 2 arms of the study, or the 2 types of interventions that we're testing, because we need to see if something works and we need to compare that against another group. So that's why we're looking at standard of care, so what's regularly given to patients, patients, or not patients anymore, I guess, but people who completed treatment versus a new program. And Amy, you can talk a little bit more about how we're delivering. So it's not only about the digital wellness platform, but we're also combining several other approaches, such as healthcare professional support while they are using this digital health platform. We have some virtual cooking classes, different strategies, again, that we're later on going to see if it works better for women surviving endometrial cancer.
Digital cooking classes. I was not aware of that. What a great way to bring people together.
Exactly.
And yeah, that's another benefit. But just to learn how to cook properly to support your improving your health.
Right. Yeah. And ideas for you to, how do you go about your daily life when you're busy? How do you make healthier choices even when you don't have time? Or how do we plan ahead?
Yeah.
So how do you reflect about your health? So it's a very holistic approach to health, as Amy mentioned, this multi-dimensional, multi-component intervention.
Right. Wow. Thank you, Carla. Amy, what would you like to add to that?
Just highlighting, I think Carla already did that well, that it is combining exercise and nutrition as well as mental health. So it's a very holistic approach to one's health, which I think is very important. But then in addition to that, it's also combining our expertise in terms of the outcome measures that we're measuring. So those are the things that we want to see if they change with the intervention, right? So we compare the differences between the two groups, and that gives us our evidence of does it work? So those measures we're doing is really a combination of, important body composition measures, including things like just waist circumference is a very well-known risk factor for poor health. Waist circumference over a certain level puts you in a risk category of early mortality, essentially. And so we're doing measures like that. We're also using novel MRI measurements to look at the fat around the organs. So that's called visceral fat. And that specific location of fat is the most important for your cardiometabolic health. So you have fat under your skin, right? That's called subcutaneous fat. And that relatively is more benign. It doesn't have as bad of health consequences as the fat specifically having it around your organ area. Individuals can also have high fat levels in their liver, and we're using MRI to measure that in particular. And then also fat levels infiltrated into your muscles. So if you think about your thigh, you have a bunch of muscle groups, and the more fat that's in between the muscle fibers and in between the muscle groups also has negative consequences for your metabolic health and future risks of heart disease and other conditions as well. So we're using really cool MRI techniques to measure the effects of the intervention on all of those things. And then we're also looking at the effects of the intervention on the heart and the blood vessels. So really trying to characterize, what are the health benefits of following this digital health platform? Because we know these are the biggest risks for individuals, that the body composition, cardiovascular health, really impact these individuals' future health and longevity after surviving endometrial cancer.
And I was just counting here, Amy. We have 30 people involved in this study. Including,
that's great.
Yes, researchers, graduate students, and nine graduate students and staff leading it. So 25 or 20 professors, 5 patient partners. So it's a huge endeavor. It's funded by, Amy mentioned, Canadian Institutes of Health Research, but also by Alberta Innovates. We have MyTex funding, also in partnership with the digital health platform that has subsidized a lot of the services for us. So it's a huge endeavor, and we're very proud to be leading that. And that's also led by, I have to acknowledge that, by our senior doctoral student, Camila Orso, who has been a wonderful mastermind behind our intervention.
Wow, that is something to be proud of. You two are part of a larger group that could save lives at the end of the day. Like, it really can. And that just makes me feel so good. I had no idea. So thank you so much. Okay, so lastly, before we wrap up and give the audience some takeaways, what gaps do you both feel still exist in how we're actually communicating health risks, especially women? And again, both of you have been very generous with your information. Some of this might have been answered, but is there anything else to add?
I can go first. I was just going to say, and again, repeating myself too, that women surviving cancer, everyone listening to us, any who has had any cancer type, but especially women who survive cancer deserve care after treatment, not just during it. And I think that, restoring energy, restoring their health, their quality of life still matters. And nutrition and exercise play a huge role in like towards this path. And I think that they need to be supported, motivated. Our healthcare system should be doing more. And we hope that evidence that we're going to create and show from our studies is really going to help to empower them as well. And as Amy mentioned, our strategy is really empowering women to take control of their health. Like we're helping them do that themselves, choose and then what works best for their schedule, for their lives as well. So I think that that's very important. And even small but consistent actions, they are very powerful at the end of the day. So even, sometimes we want to achieve outcomes very, very fast, but it's the small changes, as long as they're consistent, early and consistent. Again, remember the wildfire interventions or choices that we make are going to play a huge role. And I forgot to say, and if you don't mind me going back, the other thing that I want to leave with you is the website for resilience. So it's www.resiliencetrial.com. And we also on social media, Instagram, it's resilience.trial.u of A. And we're going to leave the link there for them, right?
Yeah, absolutely. And I will gladly just spread your links all over as well on my social media. Again, because the more we can get this information out, it can make the biggest difference in small steps over a period of time, which in my experience are more sustainable than the great big things all at once. And then it's very hard to sustain that, right?
Yeah.
All right. Excellent. Thank you so much. So I think, Amy, you just answered the question of what's your hope in sharing this conversation is to just, help people improve. But what about, from both of you again, one piece of nutrition or exercise advice you wish more people understood or acted on? And I know for me, that's the key. I can understand it. I can have the knowledge, but how do I get my runners on and get out the door? Or how do I go downstairs and fiddle around on my rebounder for 20 minutes? I mean, every little thing helps. So anything that you could perhaps support the viewers with.
I think actually, Gail, what you just said is a key part of it, is that something is better than nothing.
Okay.
So I think sometimes our messaging, like the public health messaging about how much exercise you should do, which by the way is worth mentioning, Health Canada says that we should aim to do 150 minutes per week, so 2.5 hours of moderate intensity exercise. So moderate intensity is when you're, perspiring lightly, breathing a bit more labored than usual, and doing resistance training twice a week. So whole body resistance training. So that's great that we have these public health guidelines, right? But for someone who's currently doing nothing, doing anything is much better than being like, 2.5 hours of exercise. Like that's option, right? And I think that messaging is especially really important for individuals going through cancer treatment or recovering from cancer treatment, because that can feel very daunting. A lot of cancer treatments in particular are associated with cancer-related fatigue, which is basically excessive levels of fatigue that are not relieved by rest.
Okay.
And so exercise can actually help with fatigue. It's counterintuitive, right? I'm tired, I should rest. I should not, rest my body. But actually just moving, even if it's not that high of intensity, even if it's not the 2.5 hours a week, just doing a little bit, just even getting up and moving around your living room when you might be feeling very ill from cancer treatment can be very beneficial. So I think that mentality of just movement being medicine, right?
I like that.
It's not an all or nothing type of thing. Certainly, the more exercise you do, the better. But also a little bit of exercise is also very good.
Yeah. Thank you for that confirmation.
And it's not about perfection, it's about progress.
Yeah, exactly. Definitely. And I couldn't agree more. And that's a confirmation to me. And I would just like to add one thing to that is that I know when I have different types of fatigue, and I know when I'm so tired based on what I've done during the day that I just really do need to recharge a little bit. I also know when I'm using it as an excuse to not move. So, and the energy that I do experience after going to work out. I've been going to Orange Theory for close to 12 years now, and it's quite intense, but they let you work at your own level. But the other night I went at 7 in the evening, which is not my most fun time to work out, but I went, and then I came home and walked the dog, and I felt completely different after that. And it is so true. It's like the times when I feel like not going are the times that I really am grateful I did. And it's almost like a 180 when you walk in and when you come out. I feel like a different person.
Yeah.
But it's just
that lesson, listening to your body is key lesson as well.
Absolutely.
Yeah.
Absolutely. Yeah. And my one piece of nutrition advice would be, add a little bit of protein to your diet. I promise you we're going to leave you with some resources, including our access to our free cookbook that everyone can download it. And just how can you get that more protein? And not only at dinner time, spread it out. Breakfast, lunch, and dinner. If you can't get enough through food alone, and always choose like whole foods, but if you can't get enough through food alone, there are supplements like what we call oral nutritional supplements that are also very helpful for people who can't get enough of their food, and if they're having problems with appetite, for example. And we promise you we're going to leave you the resources under the video that we're watching.
Excellent. All right. So I think we have touched on many things. Again, I'm so grateful that you shared all of this today. And you did say resources, Carla. So what would you like to share with our audience?
I will leave several links. And even if you're watching that and you're thinking of a family member who needs to hear this message but doesn't understand or don't want to hear about the concept. I've had that in my own family. We have animated videos. We also have brochures on how to calculate how much protein you need, and how to a short video as well, and then how to reach that through food. And the link to our cookbook. I'm gonna make sure that we leave that in there for you.
Thank you so much, Carla. Amy, any last words?
Movement is medicine.
I love that. That's my new mantra. Moving is medicine. It definitely
and nutrition.
is.
Moving and nutrition.
Of course. And nutrition. Of course. Yes. Yes. And they do go hand in hand. Yeah. So I just really, sorry, Amy, was there something else?
Okay.
No? Yeah, I just really want to thank you again. I'm so grateful. I know that many people that will be listening to this will be very grateful as well. The information is good. It's not something we Googled or we watched on YouTube. It's data driven. You've both worked so very hard and will continue to do so. I can't thank you enough for the work that you have been doing. And again, for taking the time to be here on the show today so we can really spread the word and make that difference that you both would like to see. So thank you very much again, and all the best as you move forward.
Yeah, and thank you for having us, for your vision, for your initiative, for being a trailblazer. Thank you so much for having us.
The pleasure was all mine. Thank you so much.
Thanks, Gail.
Thank you.